Thank you, Dr. Satyan, and thank you, Dr. Alan. Thanks, Dr. Kisharas and Ganesh Raman for making my topic so easy, because most of the things covered by you people in the previous talk, and no financial disclosure. Glaucoma is the best example for, suppose if you go for shopping or something, buy one and get one free. Something like that. Glaucoma, you have disease, but automatically with the treatment you will get all sorts of symptoms. So, as such, we physicians, we make a symptomatic disease into a symptomatic disease. And this is one aspect which is catching up in the past few years because OSD and glaucoma is currently most of the thing is under-recognized and under-treated. Definitely it has got a significant impact on the visual function of the patient, and both glaucoma as well as OSD has got a negative impact on the quality of life. And I am not going to talk about the etiopathogenesis, the prevalence, and all these things. And mainly the preservative, the BAK is the responsible for all the symptomatology of the OSD, especially mainly toxic to the conjunctival and corneal epithelium, and they have produced all sorts of effect. It's mainly because of the detergent effect on the lipid layer of the tear film. The Ganesh Raman has pointed about the 3 layers of the tear film. Mainly it acts on the lipid layer, and of course it reduces the population of the conjunctival goblet cells, as well as the main thing is about the stability of the precorneal tear film is very much reduced with all these preservative in the anti-glaucoma medications. And of course, this is just a healthy tear, how it looks like, with beautifully described about the antimicrobial activity and also the growth factor and the other things like the goblet cells, which is responsible for the viscosity of the tear film and also the electrolytes. This is where in chronic dry eye, especially when the patients on long-term anti-glaucoma medication, so much thing happens in the precorneal tear films. And medications containing BAK, especially higher concentration of BAK like darsolamide, timolol and latopraz causes more conjunctival inflammation than drugs containing alternative or unpreserved eye drops like brimonidine with pyrite, that's alpha P. This is a list of anti-glaucoma medications what was available in our country. Most of them are available all of them are available in our country. From above downwards, it's the lowest preservative level. Here it's very much the BAK concentration relative is very much less than 0.8 times. But if you go down, especially this group of drugs, this prostaglandin and fixed combination drug, they have about 8 times relative concentration of the BAK than with this drug. So if the relative concentration of BAK is very much increased, then definitely the patient will go to a severe form of ocular surface disease. This is a tear meniscus. I will come to it later about the testing. Also, some of the important tests because it's very difficult to do all the clinical tests in glaucoma patients with the dry eye, mainly because of the by clinical observation only. The other tests like tear breakup time with the fluorescein and also the lissamine green or rose bengal staining of the conjunctival and corneal cells. Commonly done test is the Trimmer's test just to evaluate the tear production, and also we have to assess the morphology of the eyelids and maybe even glands, so that this may contribute or may exacerbate the ocular surface disease in patients with glaucoma, those who are on long-term glaucoma treatment. And of course, but is one thing, swimmers and supravital rose bengal stain. All these things are some of the commonly done tests. So coming to the management is a very, very challenging problem in the field of glaucoma. we have to have a strict approach to in tackling this problem, and also we have to identify the exact pathology of this problem. And also another important thing in ocular surface disease in glaucoma is the associated ocular disease, because both is more prevalent in elderly individuals, both glaucoma as well as OSD. So some of the other diseases like lid margin disease, blepharitis, trichiasis, and ectropy, lid position abnormalities, all these things are more common in elderly individuals. So we should look upon the other aspect of the this problem as well as. And another important thing is the good counseling, because this is also it's a paramount importance in glaucoma, because we have seen patients after 2 or 3 years. First visit they will come, we will give some drops, and they will not come out for the follow-up, then they will come after 3 years. This is mainly because of the drug. They use, some patients they will used to have some sort of irritation, especially with prostaglandins, some sort of redness, so they will never, because they are coming without any symptoms. So, but with our treatment, we are giving some symptom to the patient. So, the patient will, why unnecessarily we are able to do everything, but the patient, doctor gave some drops, and why we should unnecessarily go to the doctor. Once the patient develops some functional deficit, then only they will come to it. So it's the duty of the treating physician to tell or to counsel the patient about the disease, number one. Number two, mainly about the treatment what we are going to give, especially the side effects and other things about the medication. Otherwise, it is, unless you have very good relationship, it's very, very difficult to treat the and also never ignore the patient's complaints. And these are the different goals of treatment. Number one is reducing the symptoms as well as the inflammation, and also we have to restore the normal tear volume and the epithelial integrity, and also changing some of the environmental factors and associated medical conditions we have to evaluate and treat appropriately. Of course, BAK is bad, all of you know very well, and also there is this one more thing is the stabilized oxychlorocomplex is again an alternative for the BAK, but many studies have shown that this SOC, especially timolol with preserved with the SOC, is not stable for a long time, and also IOP lowering effect is also not that good. If you that's why they are not to come up to the combination with the SOC. And of course, Alan was asking a beautiful question about the duration of the BAK exposure and OSD. And of course, both acute and chronic exposure to BAK can cause acute inflammatory changes in the ocular surface. Even 1 week is enough. That's what they say. And also in day-to-day practice, we used to say even with a patient come with some sort of discomfort and irritation and burning sensation in the 1 week of their treatment. That's acute insult to the conjunctival and the corneal epithelial cells. And of course, chronic, they can get any type of OSD. And also the tear substitutes is the only thing which is available nowadays. There are so many combinations, so many drops are available in the market. So depending upon the severity of the ocular surface disease, we can give just tear drops or some jelly or some ointment the night. Mainly the and also they discuss about the various stages of the dry eye. The international workshop on the dry eye, they classify dry eye into 4 levels. So depending upon the levels, severity level 1, just a change in the environment, better education and elimination of the offending medication and tear substitutes. And it's level 2, it's a punctal plug or systemic site. Some anti-inflammatory may help. Cyclosporine, if necessary, we can give. And level 3, contact lens is the best option. And level 4, this is surgery and other things we have to. But in glaucoma, we can modify certain things like you can So you can go for some now, because unfortunately we don't have much of preservative-free anti-glaucoma medication in the market. Only few drops are available. So if the patient is able to control his intraocular pressure with a few available non-preserved medications, and with only that drops, it's better we can control intraocular pressure. Otherwise, we have to go ahead. This is not, of course, it's not available in our country, the Tibetan is, but some other company is making this, Alcan is making Tibetan is in our country. This is preservative free, and of course, Alphagan P is again another thing. There are some other currently available preservative free drops are Timolate, OD, and RT, and these are some of the preservative free drops that helps to, but even though it's available, we don't know about their efficacy in controlling the intraocular pressure. That also we have to keep in mind. So to conclude, a proper attention to patient complaint and minimizing and eliminating the patient's exposure to extrinsic factors, minimal exposure to BAK, and also switch over to alternative preservative-free drops. And of course, finally, a good counseling is very, very important for the good compliance of the patient. Thank you very much.